series for the academic year. This is a new format that we have adopted that we have learned through our colleagues in interventional cardiology, Dr. Latif, who had made it a very successful platform, and Dr. Jordi in heart failure. This lecture series, starting today, will take place every other week. We are targeting a broad audience. Our intention is to educate in common issues in cardiovascular medicine to residents, uh, general practitioners, and to our cardiology fellows and general cardiology faculty. We have prepared a very good program throughout the year. The lectures are going to be spanning from prevention to treatment in different areas of clinical importance, clinical relevance in medicine. I hope you enjoy this. Let me make a couple announcements before we continue. Every other week, we will have also a targeted lecture series in advanced cardiac imaging. Starting next week, we're going to have Dr. Chiara Buccarelli Ducci, who's going to be talking to us about a stress MRI. This obviously is intended for a more specialized cardiac imaging interest audience, but of course, all of you are welcome to join. You will receive CME as per the instruction that have been provided. Um, Today, I am going to start a series with a lecture that will be given by Dr. Robert Ostfeld. Dr. Ostfeld is the Director of Preventive Cardiology. He's the founder of our Cardiac Wellness Program at Montefiore, and he's a professor of medicine at Albert Einstein. He had a remarkable career. He earned his bachelor's degree from the University of Pennsylvania, where he graduated summa cum laude and Phi Beta Kappa. He went and got his MD degree at Yale and his master in science in epidemiology at Harvard School of Public Health, where he completed his internship and residency at the Massachusetts General Hospital and the fellowship and research fellowship in preventive medicine at the Brigham and Women's Hospital. Having joined us to our faculty now for over a decade, he has been extremely active in educating our fellows and residents and in bringing a healthy perspective to the population of the Bronx, Westchester County, and even Manhattan. It's now pretty much an international figure. I constantly get questions about if I can introduce Dr. Robert Ostfeld to people all over across the world who follow him for his accomplishments. He had multiple professional interests in prevention, medical education, and clinical research, but of course his passion is about plant-based diet. So today we're going to talk about how to prevent all the conditions that are going to be discussed in the rest of the years and throughout the rest of the cardiovascular lectures that will be provided. So if you have your patients follow Dr. Ross's recommendation of today, maybe all the other lectures will become irrelevant. So Rob, welcome. It's a pleasure to have you today as the first person to start this series.
Well, Dr. Garcia, thank you so much for that incredibly generous introduction. It's an honor to be here with you today and with all the people joining our lecture series. I'm so excited to be able to speak today and honored to be here with you all. So I'm going to try to figure out how to share this screen. I think that works. So Confessions of a Reformed Cardiologist, a plant-based diet and your heart. So, you know, like many of you, I went through years and years of medical training and learned lots of incredible things, had wonderful teachers, procedures, medications. They can be incredibly helpful. But I frankly learned next to nothing about nutrition. I kind of knew that maybe a Mediterranean style diet was helpful, but couldn't quite define it. And that was about that. And I came to Montefiore to work and did all the things that I was trained to do, medications, procedures, encourage people to eat a Mediterranean style diet. And people got better, but not a lot better. And I was starting to get a little disillusioned. I'm like, what am I doing? And it was right around that time that I learned about the impact of plant-based nutrition. I was very taken by it. One thing led to another, and we had the opportunity to start our cardiac wellness program here at Montefiore with the goal of preventing and reversing disease with a plant-based diet. And I say disease, not just heart disease, because yeah, it's good for your heart, but it's good for you for dozens and dozens of other reasons. And I've been a cardiologist now for about 17 years. Wow. And outside of a medical emergency, like someone gets shot and has to be put back together again, I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. So I'm going to walk through a little bit of the evidence behind that, and hopefully have a chance to talk a bit about our program if time allows. And this is a case we saw early on that helped me feel like we were on a pretty good path. So this is a gentleman who he was 60 years old at the time, and he was getting chest pressure, first with walking around and sometimes sitting still. And he went and he saw his primary care doctor, and his primary care doctor did a stress test. And the stress test was positive. And of course, it's only in medicine that the word positive actually means something bad. But so his stress test indicated, of course, that he had significant coronary atherosclerosis. And oftentimes in that situation, we would then proceed, of course, adding on medications and possibly a catheterization. But he told the doc, I don't want to take any medication, any of those cholesterol-lowering pills. Okay, the patient's the boss. You have an informed conversation with them, but at the end of the day, they make the decisions for themselves. And he wouldn't even take an aspirin, nothing. And he said, Doc, I don't want anything stuck in me, so no catheterization. So we had no medication or procedural approach to try and help him with, and we were left with lifestyle change. And so this is him when he first started. And then he came to our program, and we first met him, and he was a little bit overweight. His blood pressure is a little bit elevated. You can see his LDL cholesterol is quite high, and he could walk maybe 1 to 3 blocks, and he would get chest discomfort and need to stop. So what we're going to do is we're going to circle back to him a little bit later and see how he did on a plant-based diet. So little audience participation. I guess I can't hear y'all, but I'll let you pause and think about it. But what percentage of 12 to 14-year-olds in the US do y'all think have early signs of coronary atherosclerosis? So it is indeed concerningly high, and it's about 65%. About 65% of kids between 12 and 14 years of age have early signs of coronary atherosclerosis. And this is from pathology studies of kids who died for other reasons, and they did an autopsy on them. About 2 heart attacks happen every minute in the United States, and I'm sure many of the residents and fellows on the line were up last night taking care of some of them. Cardiovascular disease is the #1 killer of adult men and adult women in the US. Women are about 6 to 7 times more likely to die from cardiovascular disease than they are from breast cancer. Now, clearly you do not want either one, but it highlights the epidemiologic importance of cardiovascular disease for women. And it's a very expensive disease process, costing more than $300 billion a year. And up to recently, about half of heart attacks happen in people with, quote, normal cholesterol levels. So in a country where it is normal for us to die from cardiovascular disease, I think our entire notion of normal is anything but. And in the incredible global burden of disease study published in Lancet last year, they found that suboptimal diet is the leading preventable cause of death worldwide, more than smoking. Smoking, of course, is also a disaster, but suboptimal diet being the leading cause of preventable death. And in this analysis of NHANES of about 8,000 people, they looked in the US at the proportional cardiometabolic mortality attributable to dietary habits in 2012. So they looked at the suboptimal intake of various foods and how that contributes to cardiometabolic mortality. So high sodium intake, more than 2 grams per day, was a significant contributor. Low nuts and seeds, high processed meats. How do they define high? As more than none. Low seafood, omega-3 fats, low vegetables, low fruits, high sugar sweetened beverages. What's high? More than none. Low whole grains, and on it goes. So this is a picture of a coronary artery. And this is a normal artery where you can see the endothelial cell here, the coronary wall. And here, of course, this is one with a lot of atherosclerosis. And you can see how someone with a lesion like this would have angina with walking around. So how do we get from here to here? Well, these are 3 cartoons. These are arteries here, and this is the wall of the artery. These yellow dots are cholesterol particles. And in general, what happens is those endothelial cells, that one cell layer here that is kind of like wallpaper and layers the inner wall of the artery, they become inflamed or injured. Now, whether that's from a toxic Western diet, pollution, smoking, inflammation, something injures those endothelial cells. And the cholesterol particles can then burrow across into the wall of the artery, where they then become oxidized and irritating like a splinter, creating more inflammation, more oxidative stress, making the endothelial cells less and less healthful, more cholesterol particles burrow across, and the plaque grows and grows and makes the artery less healthful every second of every day. So subclinically, negatively impacting you. But then there's this white line here, and that's the fibrous cap, of course. And with all the oxidative stress, all the inflammation, all the metalloproteinases that are residing here, the fibrous cap gets thinner and thinner and weaker to one random Tuesday afternoon, the plaque cracks and blocks off the whole artery. And then that's an emergency. That could be a non-STEMI or ST elevation myocardial infarction, and you want to go to the cath lab right away. But we want to prevent this from happening. This is a histologic picture of that, a coronary artery atherosclerotic plaque rupture, occluded the artery. This is a gross anatomic picture of a heart, and this is a coronary artery. You can see plaque rupture here, and this person, of course, did not survive. So we're going to talk a bit about a plant-based diet, a Mediterranean-style diet, make a little bit of a comparison. We'll talk about a ketogenic or low-carbohydrate diets, and we'll make some conclusions. And when I'm talking about ketogenic diets, I'm largely talking about an animal-based ketogenic diet. So in terms of a plant-based diet, what exactly am I talking about? And this is what we put our 60-year-old patient on. So what we're talking about is minimally processed plant-based foods. If something has a face or comes from something with a face, don't eat it. So tons of vegetables, fruits, whole grains, beans, lentils, tofu, yams, nuts, and seeds. So a plant-based diet impacting coronary artery disease. Now this thought-provoking small randomized trial by Dr. Ornish looked at the impact of lifestyle on coronary atherosclerosis in people with stable known coronary disease. And what they did is they randomized 48 people to a lifestyle intervention, which was largely, although not exclusively, a plant-based diet, psychosocial support and exercise, versus usual care. And usual care is expert care, if you will, from cardiologists just like me. And what they did is they looked at the impact of these interventions on coronary stenosis. And what they found is that in the intervention lifestyle group, the coronary stenosis shrunk on a percentage basis. And on the control group, they got bigger. And it was quite significant. And 5 years later, they were able to follow up on 35 of the subjects, and they found yet a further reduction in coronary stenosis in the experimental group. And the control group had a higher odds, meaning on a cross-sectional analysis, of about 2.5 of having a cardiovascular event compared to the intervention group. So very impressive. And not surprisingly, the more one adhered to the intervention, the lifestyle intervention, the more their coronary artery stenoses shrunk, so making a dose-response relationship. So why might eating a minimally processed plant-based diet be helpful for coronary atherosclerosis? Well, there are many reasons. One, of course, is inflammation. That promotes all aspects of atherosclerosis, and eating a plant-based diet can lower inflammation. And in a very interesting randomized trial of CAD out of NYU, they took about 100 subjects and they randomized them to a vegan diet, not completely minimally processed, but a vegan diet. These are patients with known coronary disease. The other group was the American Heart Association diet. So basically a plant-based diet versus the American Heart Association diet. And their primary outcome was inflammation, or CRP, 8 weeks later. Guess which one won? A plant-based diet significantly lowered CRP more than did the American Heart Association diet. In randomized controlled trials with LDL cholesterol, which is integral in the development and progression of atherosclerosis, in a randomized trial with a portfolio type diet, where lots of vegetables, fruits, lentils, a plant-based portfolio diet lowered LDL cholesterol about the same amount as did a low dose of a statin, lovastatin. Furthermore, eating more plant-based nutrition makes the LDL particles more difficult to become oxidized. And we talked about when the LDL particle goes into the vessel wall, it becomes oxidized and irritating like a splinter. Well, the process of oxidizing the LDL particle is more different eating more plant-based nutrition. High blood pressure, of course, is a significant risk factor for cardiovascular disease. And eating plant-based nutrition is associated in a variety of cohort studies of lowered blood pressure in a dose-response relationship. And the randomized control trial, the DASH trial, which was not exclusively plant-based, but more so plant-based versus a more traditional Western diet, eating more plant-based lowered blood pressure. There's multiple novel reasons why plant-based diet may be helpful. This one is really quite cool, our genes. So, our genes make our hair color, our eye color, our eye color. You can't change that, but you may be able to change which genes speak. It's really quite fascinating. And so in a study of prostate cancer, they took people with early prostate cancer and they had them have a much healthier lifestyle, eating almost exclusively a plant-based diet, psychosocial support, and exercise. And they biopsied the prostate at the beginning and 3 months later. And after 3 months, many pro-cancer genes were downregulated in their expression, and many anti-cancer genes were upregulated in their expression. So you couldn't change the genes you have, but you were able to change which ones speak, making the healthier ones speak more healthfully and the unhealthy ones speak more softly. Pretty mind-blowing. But it gets even more mind-blowing because in animal models, that on-off switch appears to impact not only the animals themselves, but their kids and their grandkids. You seem to pass on that on-off switch to future generations. So the dietary choices you make today not only impact your health and of course the environment, the health of the environment, but perhaps the health of your kids and grandkids. Another very interesting area is of course the microbiome. And the more plant-based one eats, more fiber, it promotes a more healthful microbiome pattern compared to animal-based foods. And that's highly relevant because we are just scratching the surface of this, but a healthful microbiome appears to have a myriad of beneficial effects throughout the body, including, so if you eat more fiber, you feed and promote more healthful gut microbiome, they secrete more short-chain fatty acids, which then feed the enterocytes lining the colon. And with that, those enterocytes may make less cholesterol. That those short-chain fatty acids promote the enterocytes to help keep a healthful, thin little mucosal membrane between the microbiome and the enterocytes, because you don't ever want those two to touch, because if they do, that creates inflammation that seeps into the body. But those short chain fatty acids can help ameliorate insulin resistance. They are anti-inflammatory. They may go to the brain and beneficially impact a variety of psychological aspects, further reinforcing the gut-brain connection. So it's really a tip of the iceberg here, and I don't have time today to get into the very intriguing story of trimethylamine oxide, where it appears eating more plant-based foods than animal-based foods brings less trimethylamine oxide, and more trimethylamine oxide promotes atherosclerosis, is associated with a variety of disease processes, including diabetes, increased platelet reactivity, and coronary and cardiovascular disease. And in this very EPCs, or endothelial progenitor cells, is another potential novel reason why eating more plant-based nutrition may be helpful for your cardiovascular system. And what they did is they did a randomized trial in perhaps the healthiest people in the world, young Okinawan women. And they randomized them to their normal diet or their normal diet plus more green leafy vegetables. And the endothelial progenitor cells, what they do is they come from the bone marrow and they replace old, more senile endothelial or sicker endothelial cells in the lining of your blood vessel. And a variety of prospective cohort studies show that the more endothelial progenitor cells you have, the better your outcome. So in this study, they had these young, healthy women eat more green leafy vegetables, and those who did that created more endothelial progenitor cells. So it's very interesting that eating more plant-based nutrition appears to have beneficial impact in a wide array of diverse pathophysiologic pathways or physiologic pathways that can beneficially impact health in general and the cardiovascular system. Of course, diabetes promotes atherosclerosis. And in this interesting randomized controlled trial by Dr. Barnard, they took about 100 people for 22 weeks and randomized them to a plant-based diet versus the American Diabetes Association diet. And those on the plant-based diet, they tried to not have people change their medications, but their sugars fell so much that 43% on the plant-based diet and 26% on the American Diabetes Association diet reduced their diabetes meds. They lost more weight in the plant-based arm. Their LDL cholesterol fell significantly more. And in those individuals who had no medication changes, which was their goal at the outset, their hemoglobin A1C fell significantly more in the vegan or plant-based arm versus the American Diabetes Association arm. But overall, it was just a trend and not a significant drop in the plant-based arm versus the American Diabetes Association arm. Right. And there are a variety of cohort studies that demonstrate a similar thing, that eating more plant-based nutrition is associated with less diabetes. For example, in the Seventh-day Adventist study, where they looked at about 8,400 Seventh-day Adventists, at least weekly intake of an animal product versus none was associated with a 74% higher odds of having diabetes. Now, of course, when we're talking about a plant-based diet, you could be eating sugar cookies all day, or you could be eating kale. And there's got to be a difference, right? Well, indeed, of course, there is. And whatever dietary, tribe or camp you may fall into, nobody thinks that eating sugar cookies is helpful. But Dr. Satija, in this wonderful analysis, put some kale on that bone, if you will, trying to help us look at what happens if we break up a healthy and an unhealthy plant-based diet and its impact on future coronary heart disease. So in this analysis of approximately 200,000 people with about 4.8 million person years of follow-up, and just for comparison, if you follow me for 1 year in a study, that's 1 person year of follow-up. So they have 4.8 million, that's a lot. So what they did is they looked at the impact of a plant-based diet on the hazard ratio for coronary heart disease. So this is just a plant-based diet in general, and this blue line here. And so you can see the more of a plant-based diet you ate, the better you did. But then they said, well, there's got to be a difference between kale and sugar cookies. So then they made a healthy plant-based diet index, which is minimally processed plant-based foods. And they looked at an unhealthy plant-based diet with the sugar cookies, stuff like that. And you can see the red line, the healthy plant-based diet, if you did that, you did even better. And if you ate an unhealthy plant-based diet, you did worse. Look over here in the second graph. The second graph shows that if you ate a healthy plant-based diet, the yellow line here, the more you did of that, the better you did. And if the red line here, that's animal foods. So if you ate more animal-based foods, you did worse. But what about this line? This line here is the less healthy plant-based diet. So if you ate unhealthy plant-based foods, you numerically did even worse than an animal-based diet. So the devil is in the details. And a plant-based diet and mortality, there's a meta-analysis of about 16 prospective cohorts from across the globe with over 800,000 people. And each serving of fruit and vegetable is associated with about a 5% reduction in mortality. Now, this is a really cool study by Dr. Song, where it was a prospective cohort of about 130,000 people, about 65% women, and they had about 3.5 million person years of follow-up. And what they asked is, if you replace just 3% of your calories from animal-based foods with 3% of calories from animal-based protein with 3% of calories from plant-based protein, is it helpful? Is it not helpful? Well, in this analysis, it was helpful. And here you can see if you replace just 3% of your calories from processed red meat with 3% of calories from plant-based protein, that was associated with a 34% lower hazard of death. Unprocessed meat, 12% lower hazard of death. And as you may know, some years ago, the World Health Organization called processed red meat a class 1 carcinogen. Class 1 carcinogens means it causes cancer. That's the same category as smoking and plutonium. Unprocessed red meat, the World Health Organization called a class 2A carcinogen, meaning it likely causes cancer. So moving down, poultry was associated with replacing 3% of calories from poultry with 3% of calories from plant-based protein. In this analysis, was associated with a 6% lower hazard of mortality. Fish in this analysis, 6%, eggs, 19%, dairy, 8%, all significant. Now that study was reinforced by a very recently published, just this month in July, analysis from JAMA Internal Medicine, where from the NIH-AARP data set, where they asked a similar kind of question. If you replace just 3% of your calories from animal protein with 3% of calories from plant-based protein, is it helpful? Is it not helpful? Well, in this analysis, they had about 6 million person years of follow-up, and they had about 230,000 men and about 180,000 women. And basically, if you look here, overall, so total animal protein. Now, what I did is I looked at overall mortality and cardiovascular disease mortality. They looked at a variety of other outcomes, but I couldn't figure out how to make a table that big, and this was pretty busy anyway. Here, the overall is if you replace just 3% of your calories from animal-based protein with plant-based protein, that was associated with about a 10% lower hazard of overall death. And in cardiovascular disease, about 11%. As you can see here for women, same kind of theme, 10, 12%. Red meat, if you break it down by types of protein specifically, the same theme, significantly lower, replacing it for both men and women. Dairy protein, significantly lower. White meat here, though, was not. White meat was neutral. And although this P looks significant, it's not, because they got Bonferroni corrected it, which is appropriate with the multiple looks of the data. And egg protein, highly significant as well. So pretty impressive, 2 different databases showing a similar theme. So a plant-based diet, to my knowledge, is the only dietary pattern shown to reverse coronary disease. It improves a variety of risk factors, inflammation, LDL, oxidized LDL, blood pressure, diabetes. It seems to very positively impact novel risk factors, genes, microbiome, et cetera, and is associated with lower mortality. Now I want to shift to a Mediterranean style diet, which is a very healthful dietary pattern, no question about it. And I want to highlight an article, I think it was just published in June of this year, where they looked at the association between healthy eating patterns and risk of cardiovascular disease. Now, the dietary guidelines, not the current ones that are about to come out, but the most recent ones, emphasize eating a healthful dietary pattern, which is important, of course, because people eat a diet. They don't just eat like one thing, like a saturated fat or a cholesterol. They eat food, which has all kinds of things in it. And so in this analysis, what they looked at was 4 different healthy eating patterns. The HEI, Healthy Eating Index, the Alternative Healthy Eating Index, a Healthy Plant-Based Diet Index, and a Mediterranean-style diet index. And the more you eat of any of those dietary patterns, a common theme they share is more plant-based nutrition. They're not exclusively, except for the plant-based one, exclusively plant-based, but a common theme they share is the higher you go on the rankings for those, the more plant-based you are. And basically what they found, whatever dietary pattern you did, the Healthy Eating Index, Alternative Healthy Eating Index, the more of that pattern you ate compared to less, the better you did, the lower your risk of cardiovascular disease. So every little bit matters, every little bit counts. There are a variety of healthful dietary patterns. And they did this with about 200,000 people with 5 million person years of follow-up. Now, Mediterranean style diet can be quite helpful. And of course, it includes tons of vegetables, fruits, legumes, nuts, olive oil, and a small amount of fish. The Lyon Diet Heart Study is a secondary prevention study where patients were eating a more typical Western diet. This is after MI versus a Mediterranean style diet enriched in omega-3 or alpha linoleic acid. And they had the Mediterranean style diet arm had a profoundly reduced risk of cardiovascular events. The PREDIMED study, of course, is a primary prevention study of patients at risk for cardiovascular disease. And they randomized them basically to a Mediterranean style diet versus a typical Western diet. And the Mediterranean style diet, which is of course enriched in more vegetables and fruits, fewer red meat, less red meat, the Mediterranean style diet arm did better. And the main driver of that was a reduction in stroke. But very interestingly, the PREDIMED investigators a priori defined a post hoc analysis that they were going to do because they knew from other data that eating more plant-based foods appeared to be helpful. So what they did is they defined a pro-vegetarian dietary pattern. And they said that under the umbrella of a Mediterranean style diet, if you ate more plant-based foods, how did you do? Did you do better? Did you do worse? So the pro-vegetarian dietary arm was vegetables, fruits, legumes, cereals, potatoes, and nuts, versus their non-vegetarian pattern was meats, meat products, animal fats, eggs, fish, seafood, dairy. Well, the highest, I forget if it's quartile or quintile right now, of the pro-vegetarian pattern versus the lowest had a 41% lower hazard of mortality. And in the Greek Epic Perspective cohort study, about 23,000 people followed for a little over 8 years, they found that the higher your Mediterranean diet score, the lower your mortality. And so they had so many outcomes and so many patients here, they were able to break the Mediterranean style diet score down into its components, like what was driving this lower mortality. So they found that it was driven in part by moderate alcohol consumption, low meat consumption, high vegetable consumption, high fruit and nut consumption, high monounsaturated saturated fat ratio, meaning more plant-based foods, high legume consumption. Cereal and dairy had minimal impact. And in this analysis, fish and seafood had a trend toward increase in mortality. But of course, that is a very controversial topic. The Adventist Health Study, this is an analysis of 60,000 Seventh-day Adventists, a cross-sectional analysis. And you can see they have the Seventh-day Adventists, of course, a religious organization. They treat their bodies like a temple, and they have multiple healthy eating patterns. And even those who eat a Western type diet, who are Seventh-day Adventists, eat a much more healthful version than the typical Westerner does. But you can see the group with the lowest percentage of diabetes was the vegans, and the group with the lowest, or only the group with the only one with the normal BMI, was the vegans as well. So it appears under the umbrella of a Mediterranean style diet that the more plant-based you go, the better you do based on clinical and mechanistic studies. So let's talk a little bit about the ketogenic diet, and I'm also going to weave in some low carb that may not be fully ketogenic, so I'm lumping these a bit together. My apologies for the interest of time. But I think that the kind of teleologic underpinning of the ketogenic diet is based on a popular myth. And what that myth is that in around 1980, they told us to eat low fat. Well, look at us now. We're fat and sick. It didn't work. Well, they may have told us to do that, but we didn't do that. We ate more of everything, including fat. So it's just based on fake news, I think, teleologically, from that perspective. And to my knowledge, there is no long living society in a chronic state of ketosis. The Inuit population, there's a romantic notion that eat a ton of fish, they live super long time, didn't have heart disease. That's not true. They have about a similar rate of cardiovascular disease as do typical Canadians. And of course, when living in northern Greenland, it was hard to find apple trees and stuff like that. So they had to, eat what they had. And interestingly, the Inuit population has a mutation, many of them, that makes it more difficult to go into a state of ketosis, suggesting, of course, not definitively, but suggesting that chronically being in ketosis may not be helpful. And of course, the blue zones, there are 5 blue zone populations across the globe, in Costa Rica and Loma Linda, California, with the Seventh-day Adventists, Greece, Italy, and I'm blanking right now on the other one, or Okinawa, Japan. They're the longest living populations in the world. They have the most centenarians. What is their diet? More than 50% carbs. It's not low carb. And it's not processed carbs, it's minimally processed stuff. And then, of course, there's the very fascinating story of the Siman people. And they're an indigenous population in Bolivia, and they have the lowest rates of heart disease ever recorded in the medical literature. And the analysis of them was published in 2017 in The Lancet. And they even were able to get CAT scans on this group of people to measure their coronary artery disease, which is really an unbelievable, remarkable feat. And so, before we got to them and probably westernized and quote ruined them a little bit, they have the lowest rates of heart disease ever recorded. What is their diet? 74% carbs, 14% fat, 14% protein. And their protein, it's really wild game. Like they're catching monkeys and eating them. And on a pound for pound basis, if you will, the Siman people, their vascular age is about 24 or 25 years younger than the typical American based on MESA data. So I'm not aware of any hard outcome studies with a ketogenic diet like heart attack, stroke, death. In one population, it can be quite helpful in pediatric epilepsy, of course, where they have refractory epilepsy, it can be quite helpful there. And of course, it's being investigated in multiple other areas. So of course, we just have to, wherever the reasonable data leads us is where we need to go. But there are multiple side effects reported when in its use in the pediatric population. And they would often start in the hospital because they were concerned about these side effects like arrhythmias, kidney stones, vitamin and mineral deficiencies, among other things. And there's a variety of mechanisms of harm. In the interest of time, I'm not going to have a chance to go into all of them. But heme iron, of course, iron comes in 2 forms, ferrous and ferric. And the heme iron, the 3+ in animal products, is pro-inflammatory, is associated with more diabetes, coronary disease, and the form in plant less so, much less so. New5GC is a fascinating compound that's been described a lot from the work of Dr. Gortz and others over at UCSD. And what they found is this is a carbohydrate that exists in non-human primates. We broke off evolutionarily many, many years ago, but it exists on the cell membranes of non-human primates. And these investigators said, gosh, it seems like, true carnivores, which we're not, they don't seem to really get cardiovascular disease that we do when we eat red meat. Does it have anything to do with New5GC? So what they thought is that perhaps when we eat New5GC, which is a foreign molecule to us, we incorporate it into our bodies, our cells, and that creates kind of an autoimmune reaction and inflammation, promoting diabetes, atherosclerosis, et cetera. That was their hypothesis. So they made mouse model where they made a mouse model look like us, no New5GC, and a mouse model that was normal with New5GC, and they fed it red meat with New5GC, and lo and behold, there was substantially more cancer, inflammation, et cetera, in the mouse model that looked like us, where the new 5G was foreign. And there are human models that are, or human studies that are beginning to have suggestions of a similar theme, but very early on. But at any rate, from an animal perspective, very interesting. And of course, animal-based foods are less helpful for the microbiome. And if you look at antioxidants, berries have about 90 times more antioxidants than fish, and plant-based foods in general, on average, have about 64 times more antioxidants than do animal-based foods. So why in the world do people do a ketogenic diet? Well, there are two main reasons: weight loss and diabetes. And a ketogenic diet can be very, very helpful for short-term weight loss. And what happens is you use up your glycogen stores, so then that you pee out water with that. You often can get something called the keto flu, so you may eat a little bit less. Now remember, I'm talking more about an animal-based ketogenic diet here. So you may eat a little bit less because you're feeling kind of crummy. And then the ketones themselves are water avid. And so it's definitely excellent for short-term weight loss. But in a meta-analysis of 13 studies lasting more than 1 year, there was less than a kilogram of difference in weight loss in a keto diet versus a higher carb, lower fat patterns. But it's definitely helpful for early weight loss. And in diabetes, it can be helpful too. But there's a question about whether outside of weight loss, it actually reverses insulin resistance. But if you're not eating carbs, your blood sugar will go down. Now, whether that promotes insulin resistance is a matter of a lot of debate and a lot of impacts positively insulin resistance is a matter of a lot of debate and investigation right now outside of weight loss. But it certainly does lower blood sugar because you're not eating any blood sugar or eating any sugar. But to me, really reversing diabetes means I can sit near a carb and my blood sugar doesn't shoot up. So we'll have to see what happens. And in a meta-analysis of long-term randomized controlled trials found no difference in glycemic control in keto versus higher carbohydrate patterns. And there are a variety of epidemiologic prospective cohort studies that suggest eating a lower carb pattern may not be helpful. And there's one particular interest for me. Dr. Lee published in Circulation. They looked at about 5,000 myocardial infarction survivors and found that those going more of a low carb, not ketogenic, but a low carb dietary pattern after their MI had worse cardiovascular outcomes. And of course, when you go ketogenic, you're leaving out some of the most healthful foods in the world, like whole grains. And in a meta-analysis with about 135 million people published, 135 million person years of follow-up, published in Lancet, they found that eating more whole grains was associated with less colon cancer, less cardiovascular disease, less diabetes. Pulses are associated with living longer, and fruits are among the healthiest foods in the world. And this is a great study by Dr. Du. And let me just jump ahead here. Yeah, okay. So, well, what Dr. Du asked, I'm going to jump to this slide first, is they looked at about 450,000 people with about 3 million person years of follow-up. And they asked at baseline, if you eat more fresh fruit, is that associated with a good outcome, bad outcome, what's up? So it turns out, if you eat more fresh fruit, in this cohort from China, it was associated with lower hazard of cardiovascular death, cardiac event, stroke, hemorrhagic stroke. It was associated with lower blood pressure and lower blood sugar. Yes, eating more fruit was associated with lower blood sugar in this cohort. But you know what? And then, of course, in a separate analysis looking at the impact of fruit specifically on diabetes in this cohort, they said if you eat more fresh fruit, are you more likely to get diabetes, less likely to get diabetes? Well, the hazard went down. The more fresh fruit you ate, the less likely in this cohort you were to develop diabetes. How about if you had diabetes at the get-go of this cohort and you ate more fresh fruit? They had about 30,000 people who fell into that category. And the more fresh fruit they ate, that is associated with a lower hazard of death, and also micro and macrovascular complications like kidney disease, eye disease. And the American Association of Clinical Endocrinologists do support consuming a plant-based diet for patients with diabetes. Let's see here. So Keto's summary, to my knowledge, there's no long living population in a state of chronic ketosis, no hard outcomes. We need more safety data. Epi and mechanistic studies, to my feeling do not support well done epi and mechanistic studies, do not support benefits and suggest potential harm, and you're giving up some of the healthier foods in the world. Now, look, we need more data. We'll see where the data goes. And there's some preliminary evidence that a plant-based ketogenic diet may be much more helpful, but we'll have to see where the story leads us. Now, after that discussion about the ketogenic diet, you may have heard of those quote guidelines that came out a little over a year ago, or maybe about a year ago, where in the Annals of Internal Medicine, where they said, oh, it's okay to eat red meat. There were a bunch of articles in there, and I want to highlight a couple things about that. The first thing to highlight is that there is substantial conflict of interest in the authors, and it's not something that I'm bringing up. I mean, the Wall Street Journal wrote sort of an expose about the profound conflict of interest. And in one of they did an epidemiologic study looking at the impact, and it was published in that journal article, or that journal, reduction of red meat by 3 servings a week. And they asked, is it helpful or is it not helpful for a variety of outcomes like total mortality, cardiovascular disease mortality? These are the researchers that came out and said, you can eat red meat, it's fine. And so what they said is, let's see what happens if you reduce by 3 servings a week. Now, of course, that's not a big difference. There are 21 meals in a week. Now, you could have said, what happens if you reduce it by 10 servings a week? So 3 servings a week is a pretty small difference. So, it's hard to see a difference if you only have a small delta between the two groups. Okay, so they're sort of setting it up to not find a difference. But despite that, if this is unprocessed red meat and this is processed red meat, eating just 3 fewer servings a week was associated with a significantly lower risk of total mortality and cardiovascular disease mortality and cancer mortality and type 2 diabetes, and similar trends or significance with processed red meat. So why in the world did they say that this says you can eat all the red meat that you want? Well, what they did then is they applied a study quality tool to this epidemiologic study called GRADE that is meant to grade randomized controlled trials, not epidemiologic studies. There are quality scores that are meant to grade epidemiologic studies. But they applied the randomized controlled trial one to this one, and shocker, it came out bad. So they said this data is terrible and don't believe it, and you can eat red meat. And so I think, and Walter Willett, I may be messing up this quote a little bit, came out and said is one of the most, if not the most egregious abuses of science he's seen. My hopefully reasonably accurate recollection of his quote. So I found this to be very misleading. And of course, there are multiple letters to the editor, calls to the journal to make retractions. So let's look at nutrients in general. This is a plant-based diet versus Mediterranean versus a low-carb dietary pattern. And this shouldn't say keto, this should say low-carb. And the plant-based diet is equal parts tomato, spinach, lima bean, peas, and potatoes. The Mediterranean is about 40% of the plant-based arm plus a half a piece of skinless chicken, 1 teaspoon of olive oil, and 1 cup of 1% milk, versus equal parts beef, pork, chicken, and whole milk in the lower carb pattern. So cholesterol, you don't need to eat any. Your body makes all you need. How about protein? Oh my God, my muscles are going to fall apart tomorrow. Don't believe me about it? You can take the world's strongest man's word for it. That's Patrick Baboumian. He is plant-based, and the reason I know he's the world's strongest man, despite being plant-based, is because he won the world's strongest man contest. Beta carotene, it's subtle. Dietary fiber, your constipation will go away. Calcium, oh my God, my bones are going to fall apart. So this is your health insurance. Let food be thy medicine, medicine be thy food. So that, a quote, doc, I did everything they told me to do. Why'd I have a heart attack? Well, it's because we haven't been telling people the right things to do. And this is a great quote, particularly for the residents and trainees out there, by Dr. Stephen DeVries. He says, it struck me as a peculiar paradox that guidelines highlight the primary importance of nutrition in your lifestyle, yet the physicians who are expected to implement these guidelines receive absolutely no education in these areas during the residency and subspecialty training. Football is coming back. In 2004, these are advertising dollars. The top 8 fast food chains spent 2.3 billion with a B, and there was a federal program then, 5 a day, 5 servings of fruits and vegetables a day. They spent 4.9 billion. I couldn't wrap my head around those numbers, so I changed it into seconds. 2.3 billion seconds, 4.9 million seconds. That's 73 years versus 2 months. We're swimming upstream, but times are changing. This is a wonderful quote from Dr. Kim Williams, the past president of the American College of Cardiology, and he recommends a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, and decrease their cholesterol. This is a great slide, busy, and I'm going to jump ahead to a couple of other things quickly. This is a busy slide, but it gets at something that I hear all the time in clinic. And that is, oh my God, you know, heart disease runs in my family, diabetes runs in my family, I'm going to get it. Well, genes matter, but of course, lifestyle matters too. And what they did, this is a prospective cohort where they had a genetic risk score on everyone, about 26 different genes. And they put them into 3 categories: a low genetic risk, which is here, an intermediate genetic risk, and a high genetic risk. And not surprisingly, the higher your genetic risk, the higher your risk of a cardiovascular event. But then what was really cool about this study is they put people into 3 different lifestyle categories: favorable, intermediate, unfavorable, favorable, intermediate, unfavorable. And you can see, even within the high genetic risk category, if you went from an unfavorable lifestyle to a favorable, you lowered your future risk of a cardiovascular event by about 50%. And how did you get into the favorable lifestyle group? Well, you ate more healthily than about 50% of the people in the study. Imagine if you ate more healthily than 75% of them. And you exercised at least once a week. Imagine if you exercised 5 times a week. You imagine it would get even better. Now we're circling back to our guy who wouldn't have anything stuck in him, wouldn't take medications. He went plant-based. He was having chest pain. Fast forward, I can't really see the numbers up top here, but I think that's about, I forget, maybe about 3 or 4 months. His weight normalized, blood pressure normalized, LDL fell a lot. He could walk about a mile and he stopped because of chest pain. Fast forward about a year, blood pressure. I don't know if you guys can hear me. Maybe someone, if anyone's listening who has my cell phone number, like text me or something. I understand I've frozen. Sorry about that.
We can hear you now.
Oh, you can hear me
we
now?
lost.
All right,
Yeah.
great. Can you all see the slide?
Oh no, you have to put it up again.
Sorry about that.
There it is.
Hopefully, all right, great.
There you go. Thank you.
Those who texted me. Hopefully we're back and running. So I don't know where I lost y'all, but this is the patient who ate more healthfully and wouldn't have to take meds or have a stent, did much, much better. And he now runs 4 miles and stops because he gets bored. So this great case from Dr. Esselstyn, and then I'll try to stop and hopefully there'll be some time for questions. I apologize about the technical difficulties. A young man in his 40s, a couple of young kids. He was having chest pain, rushed down to the cath lab. He was having a myocardial infarction. At the time, this is his LAD. They couldn't put in a stent or do bypass surgery, but he survived. He went plant-based. He refused to take a statin. That's his call. And he had a repeat catheterization about 3 years later. And this is lesion, the former lesion here. And I've never seen any medication come close to this kind of change. Obviously, this is just on N of 1, but it's a very interesting case. So what I think I'll do is pause here, and hopefully we'll have a chance for some question and answer. I'll be happy to get into details of our program, our outpatient arm or inpatient arm, some of the educational aspects that we're doing, and some research studies that we're doing.
Thank you, Rob, for an amazing presentation, very comprehensive. Apologies to the audience for the suspension briefly. I believe that there may have been interference from the Association of Beef Producers in the country. I have to ask you a question, Rob. I don't know if you can hear me here, but before that, I want to make a couple of announcements. In 2 weeks from now, we are going to have Sandy Murthy talking to us about pulmonary hypertension. I hope you can all join us. I also want to remind you that this lecture today was recorded and will continue to be available for viewing later on in our YouTube channel. So if any of your colleagues wants to watch this again or hasn't seen it and want to watch it for the first time, can access it in our YouTube channel. I also wanted to remind you that to ask questions, use your chat function. We're going to have a few minutes available for questions. It's a little bit easier than actually having you speak, since we have quite a large audience today. I do want to start with one. Actually, I have so many, but I'm going to choose one. Rob, I noticed that your patient, even though was getting better over time, had a decline in HDL cholesterol. How do you reconcile the improvement in all parameters with the decline in HDL? Have we been putting too much attention to HDL?
Yeah, that's a great question. Thank you very much for asking that. And yes, I think HDL is going to be falling off its pedestal. Certainly, we know from Mendelian randomization trials that higher HDL from birth does not appear to be protective. And we know from about 5 or so randomized controlled trials that raising HDL with medications is neutral or potentially harmful. So I do think that HDL is falling off its pedestal some, and what seems to be the most, HDL is a very complicated particle, and when you eat unhealthily, it can be pro-atherogenic, and when you eat healthfully, it can be anti-atherogenic and have more anti-inflammatory properties, one of them being its efflux capacity. And independent of HDL level, it appears that its efflux capacity is one of the key elements of its potentially being anti-atherogenic. And there is a teeny bit of evidence that more plant foods may help to benefit that, but not clear. But globally, it does not appear to be helpful. We do not have any data that changing it with diet, the absolute number actually does or doesn't have benefit. And it's been well described, however, that people who eating lower fat, plant-based diet, their HDL levels may fall. And so I kind of just look at it as a sign of compliance. I don't sweat it at all. We know that if we raise it with medications, that's not necessarily helpful and might be harmful. So I think that it's the devil's in the details, and I look at that really as a sign of compliance. I think you're muted, Mario.
Yes, I was also thinking that perhaps it has to do also with HDL particle size and whether the HDL is loaded or unloaded. I'm going to try to pick up some of the questions from the audience. As I see, there are so many that we may not be able to get to all of you. Dr. Naik makes an observation. I've seen people with pulmonary hypertension improve in his pulmonary clinic along with reversing diabetes and angina. He spoke with Dr. Exelstein, who has also noted that. Have you noticed, by any chance, improvement in pulmonary pressures in patients that have elevated, perhaps on the echo?
I've heard similar themes that the I'm certainly not going to be able to put words in the mouth of that great question. But if you're improving endothelial function with a healthy lifestyle, improving nitric oxide production with a healthful diet, perhaps that can improve endothelial function within the pulmonary vasculature and reduce pressures. And I've certainly heard Dr. Esselstyn talk about that. I don't have a lot of experience in that area. I do have one patient who has significant pulmonary hypertension and who went plant-based and who had subjective clinical improvement, but I'm not aware of any good large databases or randomized trials upon which to make any firm recommendations. So you could say it certainly makes teleologic sense, but I think that's about as far as we can go with it right now.
So a question about whether there are any specific plant-based diets that could potentially be unhealthy. Are there any that you're aware?
Yeah, certainly. If you're eating sugar cookies and white bread all day, you could be plant-based, but very unhealthful. And that work by Dr. Satija, where she highlighted that an unhealthy plant-based diet can be quite unhealthful. So yes, you can be plant-based and unhealthful if you're junk food plant-based, for sure.
Well, I ate a Krispy Kreme yesterday for the first time in years, and probably won't do it again for another 10. Given that many people have poor diet at baseline, and some of them, are interested in trying or motivated to try a diet to lose weight rapidly, such as a low-carb or a keto diet that includes some animal products, but also includes some large amounts of non-starchy vegetables. Would you strongly advise that, against that?
So that's a great question from Dr. Hall, and I think dovetails nicely into some of the studies where, if you improve your diet by about 3%, you can see benefit. And if your baseline diet is really poor, and then you go to shift toward a more low carb pattern where you're eating more vegetables, you're getting rid of the junk food, the junk food plant-based stuff, and you're having maybe more of the healthful animal-based foods, I do think that that's going to be substantially more healthful than sort of a junky Western diet with lots of sugar cookies and white bread. Now, my bias is, I do try to steer patients more toward a plant-based one, which tends to be higher carb with lots of fruits. But if a patient is really motivated to do that, and they're clearly eating a less healthful Western style diet, I mean, it's not for me. We can certainly have a conversation, but the patient is at the end of the day the decision maker. So then I do think that dietary pattern would be much healthier than a junky Western diet. So I do think that would be a better approach for that patient if they're very motivated.
Another question is, can Lp(a) be lower? We probably have, many of us have patients with elevated Lp(a), which we know it's being associated with higher cardiovascular risk. Do you place all these patients on cholesterol lowering medications?
I do not recommend medications for high level protein a. We do, of course, work to optimize all risk factors when someone has an elevated lipoprotein a, including cholesterol. So we may put them on a statin, which isn't really going to impact lipoprotein a. There are a couple of large studies going on right now looking at the impact of various medications that directly reduce lipoprotein a. So we'll have to see what comes out with that. There is a case series of not too many patients where I think it's about 16 weeks, or I forget exactly how long it was, by Dr. Najjar and Dr. Montgomery out of Texas, where they were able to lower lipoprotein a on a plant-based diet by about 16%. And I know that other investigators are looking at that, and we'll have other studies published about the impact of dietary pattern on lipoprotein a, but I don't believe it's published yet. So I don't recommend any medication specifically for lipoprotein a. We don't have a specific therapy for it. And even if a dietary pattern can impact it, we don't know for sure if that does anything. So what I try to do is get their lifestyle and other risk factors as optimized as possible.
So there's another question about whether insurance companies may be supporting any lifestyle diet programs. Particularly, there's an example of Dr. Ornish reversal program. Are you aware of any?
The only two that I'm aware of is the Dr. Ornish program and the Pritikin program that insurance supports. And I know there are a variety of other kind of apps that are programs that I think you have to pay the person, not insurance, the patient, not insurance, that will help guide people along becoming more plant-based or more optimizing their lifestyle. But the only two that I'm aware of that insurance covers is Pritikin and Ornish.
I was actually surprised in one of your slides to find out, and I think you went over it briefly, that actually eggs were more highly associated with, or reducing eggs from diet was highly associated with improvement in survival than even red meat. I was shocked to find out because, as you remove meat, many want to try to increase the amount of protein by either eggs or milk, dairy products. But I guess we can do that. And is there any study that are aware that whether the impact, the negative impact of eggs is the entire egg or only the yolk?
Well, I don't know. I don't know for sure. There certainly are studies showing that the yolk can raise cholesterol levels. I believe Dr. Don Lloyd Jones had out of Northwestern had a nice publication about that in JAMA, where I think eating more eggs raised cholesterol levels. And of course, you have to be careful about those studies because if you compare eating 4 eggs versus 8 eggs, you saturate your cholesterol receptors. It really has to be, very few or none versus more to see that kind of change. And so the mechanism, I don't know for sure. The egg yolks can, and these are, of course, they're prospective cohort studies that are multivariate analyses, but of course they're cohort with potential biases, so you can't unequivocally say that's all you have to say associated with. But potential mechanisms, the egg yolk itself can raise cholesterol. It may increase trimethylamine oxide level because of the choline in the egg yolk interacting with the gut microbiome. And then the thinking that with the egg white, it's possible that the insulin-like growth factor in the egg white, because it's highly concentrated animal protein, it may promote cell growth you don't want. But those are just my hypotheses from those prospective cohort studies.
So to demonstrate how broad is your audience, the final question I'm gonna read to you is from Padmini Sastry, who's actually a consultant cardiologist at St. George Hospital from London. And he's asking if if you're aware of any study that have looked at plant-based diet in acute heart failure or in chronic heart failure patients.
Yeah, I'm not aware of any published one. There are, I believe, there is a study being designed or maybe even implemented at Jefferson in Philadelphia, in part directed by Dr. Bellardo, where they're going to look at different dietary patterns in people with heart failure. But I don't have the details of that study. And so I'm not aware of any randomized trial looking at that outside of case reports. We have a couple of case reports, but that's just a case report.
Well, once again, thank you, Rob, for another fantastic presentation. And thank you to everyone who joined us today in this forum. I hope that you will join us again 2 weeks from now, or even next week if you have interest in cardiac imaging to listen to Dr. Vicarelli Ducci. And for your colleagues, again, they can access this series and other lectures that we have been producing regularly at our YouTube channel. Thank you again and have a nice weekend.
Thank you very much.